Hi, so I'm Dr. Nicolette Pacherno, and continuing along the theme of all the other areas that you can use Botox, we're going to show Botox in the masseter muscles today for treating TMJ, temporomandibular joint dysfunction, and for narrowing your face. And I'm going to use myself as an example because I have very large masseter muscles which are located right here, and if you see when I clench, they actually get bigger, and from face on, you can see, hopefully that's visible to you guys, that these muscles get really big because I must grind or clench my teeth at night, and the muscles are just like your biceps. If you work them, they're gonna get bigger. So Carrie, my assistant, is gonna inject Botox to that area, 20 units on each side, and I'm gonna show you how easy it is. So it's just 3 injections, and when I clench, she's going to feel it and see where the muscle is the biggest. Clench. Okay. I see it. Okay. Clench. Great, thank you. So it didn't really hurt, it's just little pinpoints, and I just want to remind everyone that this is an advanced area, off-label use of Botox, so you cannot have that done by just anyone. I would recommend an experienced Botox physician that does TMJ Botox frequently, like myself, and because you can get facial nerve paralysis or injury to other muscles or nerves in the face if you do it in the wrong location. But she's going to do the other side to make it even. But we're done for today. Thanks.